Shourav?
Yes, sir.
Move on, please. Yes. This is up to 130.
Is my screen visible, sir?
Yes, yes.
Perfectly fine. Good afternoon, everybody. And at the outset, I would like to thank AIOC for giving me the opportunity to speak to you. Just like many, I too also have been from the rigid lens era. And, as I look back, and I think, there has been never been more challengingly interesting situation than the multifocal IOL practice, the adoption part of it. And what I'm going to do in the next 15 minutes is, going to give you some tips and approaches that will better help you build the PCIOL practice in your place. So a little stats that before we go forward, something which was very enlightening. The overall adoption of the PCIOLs or ATIOLs across EPIC happens to be very low, and especially very low in India. You can see that as low as 1.2%. Australia happens to be very high, of course, but EPIC, of course, for that matter, happens to be very low. And then we decided to do a little patient survey, and there was something very interesting, and it's important for all of us to know also what came out from this patient survey that we did over 2 years back. And we found out, this was a multi-center and double-blinded survey that we did. We found out that only 8.5% of eligible patients receive an advanced technology, which is toric or for that matter, multifocal. And when we asked, what came out was 82% were actually interested, if they were given an option. Now you would say that, interest is one part of it. What about the payment part of it? Would they be interested? You'll be surprised. 94% when they were interviewed were ready to pay more for if they were offered. Now again, you would say that this might be a epic data of the Singapores and the Shanghais and the Hong Kongs of the world. What about India? And this is what came out from the India study. 7 out of 10 patients are willing to pay as much as 50,000 rupees. That's the bare minimum for a cataract procedure. And this was the saddest part of it. Only 2 out of 10 patients were actually offered a particular a premium lens or a multifocal lens for that matter.
Shourav, could you translate into dollars so that Michael understand?
Okay.
The reality of life.
Right. Roughly
about $700.
$750. Yes, $750.
700. Michael, $700 US is the maximum they will be paying. 7 out of 10 patients say it for a procedure.
Right.
Right.
So clearly there is a gap, as you can see. There is a gap. There's definitely a gap. In what patients want and what we are actually offering. And this is what this is in the next couple of minutes. I'm going to help you bridge that gap. A couple of very tiny things that all of you can do in your practice so that this particular adoption happens very quickly. So here are my 10 tips for adopting a better way of adopting the PCIOLs in your practice. All right, here are again a couple of top and I bet this is going to be very interesting. The top 4 apprehensions or the incorrect approaches by many practitioners when they deal with multifocal. I'll just read them out verbatim, and I guess many of you will be able to recognize with them. The first one happens to be, if and when patients ask for a multifocal lens, I will offer. I'll not offer them proactively, only if they ask. That's number 1. Second, I cannot increase my chair time for the sake of promoting a lens package. The third happens to be, only affluent class of patients would be interested in a multifocal gadget. I don't think so. This guy can afford one. And the last one happens to be one of my favorites, and many will acknowledge this. Is that if I offer a PCIOL package to a patient, the patient will run away, will flee, thinking that this is a very pricey place and I might lose off with the surgical patient. Let me play it safe and we go with monofocals. So I'm going to address a few of them, how these are incorrect approaches, and you can probably better come out with these apprehensions. But a big disclaimer over here happens to be the self-conviction of a technology is very important. If you're not convinced about a technology, it'll never show up in your body language and in your staff's body language as well. So I think forums like this are very helpful for everybody to get convinced about a particular technology. The first tip and the first thing is let your patients know. In the entire patient journey that I have described in this slide, the patients walk from one place to another, and there are several opportunities where you can educate the patients about multifocals or any service for that matter. Not only posters and literatures, of course, posters and literatures are important reading materials. I'll just give an example. For example, an optometrist, when he or she is examining the patient, just after the examination, can put a word, Mr. Patel, your eyes are very healthy. You might be a very good candidate for a multifocal lens. My doctor is going to talk more about this. That's about it. And the patient he's already preconditioned, and that's in the entire journey, he gets that feed, and then he moves forward. Likewise, there are several opportunities they can do. Several, these days, today in India, the Paytm and the Google Pay and the Phone Pay, there are close to 750 million users in India, which means that many people or the patients or caregivers who know how to use and how to scan a QR code. So QR code based education is very simple to make. You just convert your patient education contents into QR code and place it over there. The materials that the companies give you, the posters and literatures, do not just keep it as it is. Strategically designed places, just not the place where there was a vacant wall and you keep it. These are important resources for you, which will really help build a practice. The next one I'm going to talk is a very interesting thing. But before that, I just want to share a small slide which talks about the patient journey. The patient journey or the education happens much before the consultation. The time between the symptom and the diagnosis is also a very important period for a patient to learn about. And this is where, the importance of pre-read material, this is not a very in thing in India. And, Dr. Michael Lawless, later I'll ask him, it is quite a familiar thing in other countries, but it's time that we all gear up sending patients through WhatsApp, simple PDF materials, before they reach, on a schedule appointment before they come. They might not read everything, but even if they read something and they come back, the entire conversation will be much more different as we move forward. So that's something that you can easily do. A real biggest game-changing tool that Dr. Abhijit Desai also spoke about it, and it is very simple. Is just having one lifestyle questionnaire before the consultation. That's my tip number 2. A lifestyle questionnaire is nothing but just a collection of 6 questions where the patients are just asked, are meant to write actually, that what are the things that they want to get rid of spectacle, what are the things that they would be happier about. What happens is psychologically is they start thinking. They would have never thought that a life without spectacles was even possible, but once they tick this, they start thinking, oh, this is also possible. And also it makes life easier for the consultant and the counselors, because of the fact that now they can say that the conversation picks up from the fact that as you said that you wanted to get rid of spectacles and you want to do ABCD things. Here is something. So the conversation line totally changes. And by the way, my humble suggestion to all of you would be never undermine the need of spectacle independence from a patient. It could be very vackier than you could have even imagined. As wacky as somebody wants to get rid of the spectacles just because there was a nose marks, he wanted to get rid of the nose marks. Or somebody, I learned this from ophthalmologist that a patient wanted to get rid of spectacles because he loved playing cards and bridge. And he says that every time he holds the cards, the reflection of the cards is seen by somebody else, and he cheats upon me. So that could be as weird as that. Somebody wants in retirement time, a patient wants to, the switches over to health, fitness, and spiritualism. They want to do to marathons, and that becomes a hurdle if they have a specs and other things. So do not undermine their reasons for getting rid of spectacles, and hence the importance of giving a chair time. In the initial days, your chair time is actually the investment that you make. It's not spending, it's the investment. And nobody can supplement their chair time. So your personal chair time is important. Use the tools and resources that is there, or you could just scribble around in a pen and paper. And eventually your staff will go ahead and adopt it. But you should always end your conversation making a recommendation. And recommendation is very important. A recommendation from a surgeon is one of the most critical things. Several tools that are available, you can just make a recommendation using a pad saying that this is something that I recommend. However, my counselor is going to talk more about this. Now, typically, I'll just give in a format of what recommendation typically would sound like, as again, something if you feel is like selling or, or sounding, this is what it is. You would want to, and I'll read out verbatim. based on your visual needs and your eagerness to get minimally dependent glasses, I would recommend a multifocal implant. However, whatever you choose, me and my team will do the best. Likewise, Mr. Das, for your father's visual needs, had I been in your position, I would have opted for a multifocal package. However, whatever you choose, me and my team will do the best. You will never sound selling or pushing on this, because this is a strong recommendation. And that's something that you're all most of the time, don't get away saying that whatever you choose, आप जो choose करेंगे अच्छा ही होगा. It's very important that many times misconceptions happen in this particular type of multifocal or ATL practice. So it's very important at this point in time, the role of the counselors. The counselors play a very critical role in reducing your chair time, but also giving this, where the patients are able to openly ask many questions that he or she was not comfortable asking to you. So engage a very nice, smart counselor in your practice, and that's no shortcut. You ought to engage a good counselor in your practice for sure. Typical, how do you communicate a one-liner benefit of a multifocal package? And I've jotted down a few of them, and again, I'll read this out for you. Some of the best and the safest way to put this is number one, with the implant of this lens, you will find that for 90 or 95% of your activities, you'll not need to wear spectacles. Next one happens to be, you could also say that if you walk out of the house and you suddenly realize that you've forgotten your specs, even in this situation, you'll be able to manage the things well. Multifocal lenses are designed for active individuals like you, because you're complementing them. And most of my patients who have received this implant, they have seen a wonderful change in their lifestyle, a one-liner with this. And then you could say, with the advent of the new technologies, you can now help you reduce the dependency on the glasses. Had you come to me a few years earlier, I would have not been able to offer the same thing for you. Dr. Abhijit, I just mentioned about the halos and glares conversation. If that's something that you want to mention, as Dr. Vasada also said, that first thing you should be mentioning about them is not compare your, that should be for the counselors, the regime that do not compare the other eye, until the bilateral implantation happens. Simple cards they would be happy to share with you. You can share with them. These are pictures. You can say that your journey of the halos and glares could be from here to here. This is what it could be like. But after 6 months, this is what it's going to be like. If they never notice it, they are very happy. If they notice it, they know that I was always told about it. Again, managing patient expectations. A simple summary card that you can design by yourself, which says that this is what which towards the end of this discussion, the counselors could, recap and say that this is what we decided, this is the lens, and this is what we're going to offer, and they sign up and move away. So that also helps by and large, in managing the expectations, and they know what they're getting versus an implant. A simple tool again is the biggest resource that you can have is doing your own patient testimonial videos. And normally, most of the times, you feel that you might have to give them a video, you might have to get a video guy, you have to plan and so on and so forth. I've seen several practitioners, doing this with a simple mobile phone. It's just about giving somebody the job that, every time you get a happy patient, ask those 3 very simple questions. And there are several softwares that are available, free applications which are available where you can do this by yourself. Make a collage out of it, put it in your OPD, put it in your website, and you will see a lot of patient footfalls coming out by the simplistic. It doesn't have to be flamboyant, but simplistic patient testimonials which comes out natural from the patients. One point that I want to quickly stress upon is the importance of the post-operative counseling, or the wow factor. A patient will will multiply only if your patient turn on to become an ambassador, if they go out and say this. And when do they become an ambassador? Because once they have that wow effect, yes. And it's very important, even after the session, after the surgery, after the session, that you spend some minutes with them discussing, and in using a couple of tools and resources, very simplistic, which creates the wow factor. What really happens, and we did a little survey based on it, that when the surgery happens and the surgery is done, many of the patients felt, well, this is how it is supposed to be. What's the big deal about it? Even if they had a multifocal lens in their eyes. But then when you explain that this is what it was, versus this, like for example, a pre-operating evaluation sheet that you see at this point in your screen. Before the surgery, you make your patients actually, read a particular point, and you make them sign that this is what I'm able to read at this point in time. After the surgery, you open up and you again bring the same sheet and ask him or her to read, and they will see, and then they say that I'm able to read 2 lines extra. And you say you already signed up earlier, so this is what we've achieved. This is this new lens, you've already, and then they become much more happier as they move forward. Caregivers are the decision makers, as we know, so use relevant terminologies and simulation packages that they understand much better, so then and they're going to be helpful in that communication. Two more pearls before I wind up is pricing. How do you price your multifocal? Well, keep your fee structure simple, and I'm going to talk in a minute what do I mean by a structure, a simple fee structure. Charge appropriately for your PCL package. And I've heard Dr. Shourav speak many a times, and I love this, and I quote this many a times, that never do not feel apologetic when you charge a particular multifocal lens, a particular price for a multifocal lens. Just charge that appropriately. Try this trick. Use the reverse package confirmation. And also, I'll just take 2 more minutes before I wind up. Use the reverse package communication. What I mean by reverse package is, normally you would say we have packages from 35,000 to, let's say, 90,000 rupees. Reverse it, reverse and try and say that, we have packages from 90,000 to 35,000, or multifocal is my best take, and the fallback option happens to be monofocal. And there are several other ways that you can do. When I say simple fee structure, many times we have seen it that we have a menu kind of a structure. Very simple fee structure is simple for patient to understand. Surgery type, lens type. In lens type, you have a standard lens and a lifestyle lens. If you have astigmatism, you have toric, else you have PCIs. There has been several studies that have come out, saying that if you in these days, if you give the EMI option to a patient, they tend to move to the next package very easily. There's interest-free EMI option. The simple thing that you need to do is just call up your banker, and they'll connect you with the retail banking division, and they'll be happy to give you this offer, and and they do the marketing themselves. And you'll see that a patient who would have never gone on the other side suddenly has decided to go for a multiple package. And the last, before I wind up, is no patient will be in a state of mind to listen to flags or multifocal if they are irritated. Hence, a good patient experience is very critical, important, and that's also something that you would want to look into going forward. So in summary, what I would say that, 3 things that I would want to summarize: inform your patients completely about this, recommend wholeheartedly, as I said, and build ambassadors for your practice and for the particular package. And you'll see much more patients. You'll be able to reach out to much more patients with these wonderful technologies that are available today. Thank you so much with this. Thanks for your time.